Well, let's bring in Dr. Joe Congini right now, Akron Children's Hospital, with us. And Joe, hard to believe it. Sports does go on in a limited view, and that right now is the NFL draft next Thursday. And right now, the OHSAA with the spring sports season came out with a tentative schedule, and that's still very much in limbo. From a sports medicine perspective, how difficult is it to ramp these springtime high school athletes back up to get ready to play after taking 5-6 weeks off?
Well, Ray, I think very difficult. And so, yes, you're right. It's in a very limited way. I mean, the NFL just doesn't seem to stop for much of anything. And so most of the spotlight of anything going on reality-wise in sports is related to the NFL draft. The NBA draft's coming up in a little bit too. But, one of the things is I know that everybody's saying that they're very comfortable with looking at people and getting to know these prospects through a virtual standpoint, doing virtual interviews, doing virtual examinations. But I know deep down, as somebody in musculoskeletal and orthopedic sports medicine, we're not altogether happy with a virtual examination on some of these guys. And so I know that there's some people that are uncomfortable. There's millions of dollars decisions being made out there on people, and they're not getting their hands on some of these players to know. So I think in the combine, a lot of the first-round draft choices, like, say, for instance, the Browns, who they're looking at all the tackles, they probably got their hands on all the tackles. But when you get to this level of sport, almost everybody has injury baggage they bring with them. And you want to interview them and examine them on your own with your hands and see them. And people probably would have trouble understanding that. But one of my mentors way back a long time ago called the examination kind of on some of these players the holy trinity of three different things that you want to get out of your evaluation with people. Number one is the history, what they tell you the injuries were and the problems they had. Number two is the physical exam. You want to put your hands on, see what the range of motion, the strength. You want to put them through the paces of seeing what we call functional testing to see with movement, how they move and things like that. These are big decisions being made. So number two is the physical exam. And number three is the X-ray studies and the tests that were done and perhaps the surgeries, the X-rays and things like that. If you have just one of those three, you don't have a complete exam. So that, in other words, sometimes we get MRIs on people, and we might find things on an MRI that have nothing to do with the problem that with the athlete that we're seeing. So we may see things that really are what we call kind of red herrings that have nothing to do, or they're not really the pain generator or the problem area if the athlete had a problem to begin with. And most of these athletes did. So I think the real problem area, Ray, for the draft in the NFL and coming up soon in the NBA to do these virtual exams is going to be not in round one as much because they got their hands on them, but rounds 2, 3, 4, they're going to be taking a lot of projections without getting a chance to get to that second and third part of the exam, if you know what I'm talking about. You might get some of the reports about what the study showed a year ago or 6 months ago, but you don't get a chance to get your hands on these people to really see the exam, talk to them, get a good history. And I know that is probably a little unsettling when you're making decisions for millions of dollars. So this year may be a year that there's some people that really miss in the draft.
Joe, let me ask you this. OHSAA, and let's say in a perfect world, the curtain does get pulled up second, third week of May. From a medical standpoint, you a little bit worried about maybe springtime injuries to these young athletes?
Yeah, Ray, that really took me by surprise, and especially since, I'm on the medical committee, I didn't hear any talk of some of the decision-making on this, and maybe it was made at the executive committee at the top, or maybe just kind of trying to throw it out there to get a sense of it. But first of all, the timeline, I'm not sure exactly why they came up with the timeline a week ago when it's really totally up in the air and a real major question about moving forward to begin with. And then secondly, of course, what everybody in our field's talking about is that is a very, very short timeline. Talking about athletes getting in there, starting doing some practicing. I believe the date was May 4th. and then starting some games 5 days later on May 9th. And that's already then a shortened season. May is the time when things start to wind down with spring sports a little bit. That would be a very shortened period. And whereas there might be some control in the professional ranks and in the college ranks about what these kids were doing, I think in the high school ranks, the athletes I see, I'm really worried that it's all the way across the board of people doing next to nothing at all versus some things they may or may not be doing. I know you asked me the other day, I know there's people trying to make suggestions of what people can do on their own to get in shape, but I think you're going to see people all across the board, and that timeline does make me nervous. I have to admit to you, Ray, and I just didn't see exactly the cause or reason for it right off the bat until we know a little bit more. And I have to admit I was surprised by that when I saw it. But reality is, I mean, my read on it, you're much closer to the situation. I'm not so sure how good of a chance it is that this 4th to the 9th is really going to happen.
All right, Joe. Good stuff this morning. Education as always, my friend. We'll catch up with you next week.
Hey, Ray, I have to tell you, I had a great week personally. I had a granddaughter in the last week. That's the good news, that's the time where we're at family-wise. The bad news is I'm stuck up here in Ohio, and the new baby is down in South Carolina. But we had our own personal really good news. She went home yesterday from the hospital. So thanks very much, and let's get through this period, Ray. We'll get through it.